Good afternoon. It's Wednesday, July 29th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball, the Honourable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Well, good afternoon, everyone, and welcome back. We will begin today's media availability with Dr. Janice Fitzgerald for the overnight update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province, and our total number remains at 266. By region, we have 245 cases in Eastern Health, 11 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% male, and by age, we have 23 under the age of 20, 41 between 20 and 39, 39 between 40 and 49, 59 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 259 people have recovered from the virus, and we have tested in total 24,333 people. This virus has tested our limits in ways that we never thought possible. One resounding takeaway has been the importance that kindness plays in adhering to our public health guidelines and measures. We have all seen examples of this throughout the course of the pandemic. We have seen acts of kindness within our families, shared on social media, and in our daily encounters and within our communities. It is these actions that have lifted us and reminded us of what is important and what will help get us through this difficult time. As we continue to navigate living with this virus, please remember to take a moment and put yourself in someone else's shoes before you make comments, especially on social media. These types of comments are generally not helpful and can hamper our effectiveness. Kindness can be shown in many ways, and one way is through our respect we have for one another. By being mindful of people, space, time, and place, you are helping to prevent outbreaks in our communities. Think of people, space, time, and place to help guide you and your family in your daily activities. Remember to keep your number of close contacts outside your bubble as low as you can. Be sure any space you're in is large enough for physical distancing. Remember, the longer your exposure to those outside of your bubble, the higher the risk of transmission, and know that indoor activities are higher risk than outdoor activities. COVID-19 is with us for the foreseeable future, and our public health measures play an important role in preventing the spread of the virus, so we must not become complacent with these measures. Please continue to stay at home when you are unwell, cover coughs and sneezes, practice good hand hygiene, maintain a safe physical distance of 2 arms lengths from others while in the workplace or public spaces, and wear a non-medical mask when that is not possible. These protective measures will continue to be our best defense against this virus. While you are familiar with seeing Premier Ball, Minister Haggie, and myself at these briefings, we have often mentioned the incredible team supporting us and the province as we continue to navigate through this pandemic. And I'm going to try to say the next part without crying. One of our team members is coming upon a milestone of her own. Colleen Sims, Assistant Deputy Minister for Population Health, which includes the Division of Public Health, will be retiring on Friday. Her name may not be one familiar to many of those listening today, but her work in mental health and addictions, particularly with Towards Recovery, has touched each and every one of us in some way. Colleen, I want to thank you for your dedication to the health of our population. You have been steadfast in your leadership and a tremendous support to those around you. We will miss you in the Department of Health and Community Service, and we wish you only the best in your new adventure. No one is more deserving than you are. And today is also my last briefing with Premier Ball, and I wanted to take this moment to say thank you to you for your service to our province, especially through this pandemic. I wish you all the best as you step away from your role as Premier, and I hope you get some well-deserved rest. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 266. So let's continue to stay true to form and be kind to one another. Our communities, our humor, and our kindness will get us through this together. Thank you very much.
Well, thank you, Dr. Fitzgerald, and congratulations to Colleen Sims as well. It's Dr. Fitzgerald is right. You know, Colleen has had a very distinguished career in Newfoundland and Labrador, especially around mental health, and I've met her and worked with her for on many occasions. And I too want to join Dr. Fitzgerald in congratulations and sending all the best to Colleen in whatever the next phase of her life will take her. As Dr. Fitzgerald said, no new cases today, and we still have 4 active cases in Newfoundland and Labrador. But this is all thanks to the public health officials who have done a really good job in contact tracing. This is really helping stop the spread of COVID-19 in our province. And we certainly wish the 4 people that have tested positive, we wish them a speedy, a safe, and full recovery. As we have said many times during these briefings, this is not unexpected, and this goes as a reminder to us that we must not let up. We must remain vigilant in all our actions or decisions to keep this virus at bay. Now, over the past few days, there's been a lot of discussion reports that we've seen, especially around social media, about a number of U.S. servicemen taking advantage of our downtown area in St. John's. Now, under normal circumstances, this would not be unusual, but in these pandemic times, it is in an unusual situation. So, Minister Hagee has been mentioned in recent days as being investigated, and I'm sure he'll have more to say about this in his comments today. Now, in one sense, I see this as a bit of a silver lining, because I'm pleased to hear that this is being reported. Reason being, you're doing the right thing in being in raising awareness and the possibility of people not following either the travel or the self-isolation guidelines. This is exactly the reason why we have a public report system in place on our COVID website. But it also tells us that our residents are very much aware and keen on protecting themselves, their family, and their friends. So thank you for continuing to follow the health guidelines that have been put in place by our public health officials. And thank you for drawing attention to others who may not be. Now, as I stick with the topic of travel, travel continues to be closely monitored by our public health officials and our Chief Medical Officer of Health. Whether it's traveling within the Atlantic bubble or those entering the province through some other but yet approved reason, could be something as simple as work. Rest assured that any broader movement to other Canadian jurisdictions, or could be families connected to our province, or easing of travel restrictions for Newfoundland and Labrador, will only be determined and guided by our public health experts, led by the Chief Medical Officer of Health. Safety of Newfoundlanders and Labradorians is and will remain our #1 priority. As we look at the latest travel numbers for our province, it shows that over 12,000 travel exemption requests have been approved, and this is within the timeline from May 4th to July the 26th. Now, when you look back at the points of entry, and there's quite a few within our province, as an example, just yesterday we had 1,276 people come into our province. 737 of those were non-residents, and typically would be coming in with a travel exemption. Now, the points of entry where people are entering and seeing the most traffic again will be in the Labrador-Quebec border. This is in Labrador West, St. John's International Airport, and the Marine Atlantic Ferry Terminal that will be in Port-aux-Basques. The busiest area continues to be the Labrador-Quebec border in Labrador West. This is an area, of course, for many, many decades now, has been an area where, with the Quebec, on the Quebec side and the Labrador West side, the residents there have been very used to traveling back and forth to that border for many services that is shared. And so with that said, we're not really seeing a huge amount of new people coming to our province from outside either of those jurisdictions. Now, if anything was to change with travel restrictions, either with the Atlantic bubble or further expansion, I can assure you that you'll be informed well in advance. As I said, your safety is the #1 priority. Now, as we move forward, please be sure to stay informed, be prepared, and follow public health guidelines. Once again, I point you to the COVID-19 website. It is a website that has been created for you, and it's been working, and it's been a very busy website, and it's all the recent and up-to-date information for you, your family, and your businesses. We also have a COVID website available, which has specifically been created for the youth in our province, and we've done this specifically for our youth because we know there's a certain language that you need to be able to communicate effectively with our youth. That is why this website was designed. Now, our government and our health officials continue to work diligently, day in, day out, to put supports and resources in place for both residents and business in our province. This includes, once again, a focus on mental health and the well-being of our residents. And this is because we know that during this pandemic, it has an effect on people's mental health. It creates stress, creates anxiety, especially when we find people that are in self-isolation. We see this in our seniors population. It's been obvious, so it's important now that we must continue to support them. With information on mental health and COVID-19 scattered all over the internet, a number of sources, now finding the accurate information and appropriate resources can be difficult and confusing at times, and we often hear things that people would have found on the internet being shared almost as if it was fact. Well, in actual fact, it is not that. That is why we must point you towards some of the factual information and a trusted website like bridgethegap.ca. This is an online resource designed to support mental health awareness both in adults and in our youth. Now, as we move forward, let's remember to be mindful and respect those around you. Continue to practice good hygiene. I know it goes without saying, but a friendly reminder will never hurt. Wash your hands. Do not touch your face. Wear a mask when you're in an area where you cannot practice good social distancing. And practice proper sneezing and coughing etiquette. Now, these are not our task. These are easy to follow, and these guidelines have been working for you, and they will continue to protect you from the spread of COVID-19. So I thank you once again for all your efforts, and let's continue to stay safe while working through what is a new normal. And it's quite often now we get people talking and saying and repeating those words that this is indeed a new normal. We have been doing a remarkable job. So let's keep the momentum going. We have the resources and the responses in place that if indeed from time to time a positive case would pop up, we can respond to that quickly and swiftly. The last thing we want to do in our province is see a step backwards. We've all worked too hard to get where we are, and we need to stay where we are in these times. So our collective effort, as we continue to move forward in our plan, Living with COVID, is a battle that we can only win by working together. So I thank you, and I'll now pass it over to the Minister for his comments today.
Thank you very much, Premier. Again, another day with no new cases. So we have 4 active cases in the province at the moment, a testament to the hard work and diligence of all Newfoundlanders and Labradorians, as both the Premier and Dr. Fitzgerald have referenced. The 4 that are active are a younger demographic, however, and that is a trend that we see across Canada currently. And I think that speaks to the lack of selectivity, as it were, of the virus. It will pick up on anyone and will move with them as chance offers. I think it's important that all age groups bear in mind that this is a virus that can affect them. It's not specific to the old, it's not specific to town, it is everywhere. And I think with that in mind, the public health advice that you've heard from Dr. Fitzgerald and from the Premier cannot be overstated. From the point of view of recent developments in the healthcare system and in society, the issue of the US service personnel around town earlier on this week has obviously been very prominent. Investigation by my department and public health has shown basically this was a misinterpretation, a failure of communication, if you like, whereby the servicemen misunderstood instructions. Those from CBSA were somewhat more ambiguous than ours, and that left them with what they thought was leeway to do what they did. We have corrected that. We have gone with a very clearly worded memo to every fixed base operator at the airport, the facilities to which these planes would normally go, with very clear language, very clear expectations, and offered the availability of personnel from the Department of Health should the need arise to further emphasize these. We have also circulated this memo to every hotel in the downtown area, so there is absolutely no doubt in anyone's mind what the intention of public health and the Department of Health and Community Services is regard to expectations. We have worked with Public Safety Canada at the federal level to make sure our desires and wishes and recommendations are followed. And we have also engaged at the federal level military liaison to make sure that our allies in whatever country are perfectly aware of the responsibilities of overnighting service personnel. They get off the plane, they go to their billet, to their hotel, they stay there and they reverse the process the following day. Unfortunately, without 14 days of isolation, they are not free to do anything else. And I think, given the tenor of the discussions, that message is very clearly delivered. On the healthcare system front, I would like to take this opportunity to thank Regional Health Authority staff for their hard work in ramping back up the services of planned elective procedures over the course of the last little while since we moved into Alert Level 2. We are over 85% for pretty well every area within Regional Health Authority facilities. We have some equivocation around that number when it comes to primary care, but on the flip side of that, we've seen a 7-fold increase in virtual care consultations. So across the board, primary care is being delivered through RHA personnel and staff. Virtual care has really been very important to us, and for those without regular access to primary care, there are alternatives, and I would draw your attention to 811 for sure. Life with COVID is what our plan is about. We're not in a position where we have the time to hide away until this virus goes away. It is going to be with us for some considerable length of time, and even the most optimistic projections about vaccines are well into next year before they're going to be widely available, safe and widely used. There is a new medication now licensed by Health Canada for those with severe manifestations of COVID-19, and that's another tool in the toolbox. But again, that is as much hope at the moment as it is based on hard, large numbers of scientific assessments. So again, I think in terms of our best defense, physical distancing is and remains our single most useful weapon in dealing with and living with COVID. We need to adapt to that and always bear that in mind. Dr. Fitzgerald has given us her toolkit of people, space, time and place as a checklist to allow everybody to make a risk assessment of any situation in which they find themselves. And for those areas where contact may be unavoidable, then non-medical surgical masks are known to reduce risk. Hand washing and good sneeze and cough etiquette are also very important. So those public health measures are key and will remain key for the next year or so. I think it's only appropriate at this stage, before I finally clue up, Premier, to echo your comments about Colleen Sims, our Assistant Deputy Minister for Population Health and Mental Health. I first came across Ms. Sims when she was Director of Mental Health and Addictions, and she has been a key figure in the architecture, literally and figuratively, around the replacement for the Waterford and the new adult mental health facility that we had the pleasure to announce very recently. I would also be remiss if I didn't comment on the fact that this is the Premier's last time in the middle seat, the hot seat in many respects. And I would draw your attention to the fact that the leadership at the provincial government level has been key in putting this province at the forefront of those that have been successful in managing the first wave, or at least the first manifestations of the first wave of COVID-19. And it's been a pleasure and a privilege to share this platform for the last 100+ days. I've lost count, quite frankly. And I think it would be sadly lacking if I didn't, on behalf of my department and probably even the people of Newfoundland and Labrador, just take this opportunity to thank you for your leadership. And with that, I will be quiet now and take my seat. Thank you, Premier.
Thank you. And thank you, Minister Hagee. It's been 144 days, I think, that we've been providing COVID briefings. I think Dr. Fitzgerald started out on her own, and then we joined the band, as I say. So before we conclude today, I want to take a few minutes near the end of this media availability, closer to 3 o'clock, and I want to have a few closing remarks before we sign off for today. But right now, we turn it over to the media. Back to you, Kathy, to organize today's media availability.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions, and the purpose of these briefings is to address COVID-19 issues only. All other government-related issues should be directed to the appropriate department or agency for response. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Thank you. Minister Haggie, American military flights have been coming and going throughout the course of this pandemic. Why is it just now, 144 days in, that the rules are finally being sorted, considering that this isn't the first time that American military flights have been coming and going, and the instructions they've been given have been from the CBSA that they don't need to isolate?
The instructions from the CBSA, if you read them, are actually ambiguous. They allow for exemptions to self-isolation only under the circumstances where these are essential workers and are at their workplace. And even then, they should wear masks and physically distant. The issue from our point of view is that this has been essentially federal jurisdiction. And we had no knowledge directly of these flights. We do not have access to or influence over what happens on airport territory. And that has been an issue that's come and gone over the course of this. Certainly, after each of these incidents, we had gone back to fixed-based operators and we had tried to clarify with CBSA around language. Really and honestly, we kind of took matters into our own hands yesterday when it became apparent that there was a vacuum in information. And we, I think, now have dealt with that to my satisfaction currently.
We've heard from bar and restaurant owners. They're worried about their staff being put at risk, as well as other patrons. They're also worried about the fact that some of this enforcement now seems to fall to them, and that they're having to try and tell people, no, you shouldn't be going out or going in. What do you have to say to them about, why they're sort of on the front lines of having to deal with this?
No, I mean, I've heard those comments. I think the actions we've taken will remedy that. I would also say, however, we all have a responsibility to recognize that we are living with COVID-19. And any business is free to refuse to serve someone they feel is a risk because of a lack of diligence or a lack of application of the recommendations or special measures orders from the Chief Medical Officer. So we all have a part to play. I think the measures I've outlined emphasize the importance that we've put on getting this right going forward.
Dr. Fitzgerald, a question about wearing masks. We're now seeing Nova Scotia is just days away from making them mandatory for inside spaces. There's a recommendation here to wear them. They want this in place in advance of the second wave because they want to make mask wearing the norm. Right now, anecdotally in this province, mask wearing is not the norm. Are we looking at making them mandatory?
It's certainly something that we are investigating at the moment as to whether or not what the effectiveness that would be given our prevalence at this point in time. There is some concern that there may be mask fatigue as time goes on, and we don't have if we continue to have a low prevalence, that people may not feel they need to wear them. So we certainly want when masks are most effective is when we have higher prevalence in the community. So we certainly wouldn't want mask fatigue to develop before, and then end up with a higher prevalence and people not be wearing masks or not want to wear masks. So that's something we have to consider. But it is something we're actively looking at this point as to whether or not we should do that, and if we decide that we should, when we would be the best timing to do that. But the decision isn't final at this point.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Sorry about that. I have a question about the American personnel and it goes to a kind of a mixed message. We're told not to ask rumor-based questions, but somehow there's a line between a rumor and being a good citizen and reporting possible violations. How do we make that distinction?
That's a very good question, Peter, in actual fact, and I think it's a movable target. I am always concerned about social media as a method of reporting to the department. I have a Facebook page, and the response to messages there is an automatic one which simply says where to go to formally document this with government or with the appropriate agencies. Social media, Facebook, Twitter, whilst convenient for some, is not a medium that is appropriate for doing this. You'll find law enforcement don't use it for that. So I think that's one of the challenges, is directing people in the right way. I think if people have concerns, they should report them. There is a mechanism through the COVID-19 website. We've done that very clearly. There are channels through the Department of Health, and I would encourage anyone to use those. The challenge comes when you get a single post, particularly on Facebook, which suddenly is shared 700 times. And it turns out to be based on rumor or second-hand or third-hand information or a picture that is 6 weeks old. So those become real challenges. And I don't have an answer that you can use every time, except if you are concerned, there are proper mechanisms. Please use those. Go to the COVID-19 website. That will tell you what's going on.
Okay, thank you. And I wanted to ask Dr. Fitzgerald, the woman who returned from Southeast Asia, there are a lot of questions swirling around about how she would have gotten on a plane. Do we know whether she had any obvious signs of COVID-19, or was it something that was realized in retrospect?
So I can't speak directly to a case, but my understanding is that symptoms were mild and perhaps not recognized, as you say, until in retrospect.
Okay. And I also wanted to ask if there are if there's any movement with respect to establishing guidelines for choirs and those people playing wind instruments. Has that gone any further?
At the moment, we are in the process of reviewing that evidence that we have, and so we aren't any further with regard to a recommendation at this point, except to say that we're examining the evidence. But we've had lots of questions that we do have to work through, and we have a small team, so it does take us some time. So I ask for people's patience as we do that.
Thank you.
Our next questions are from Allison King of VOCM News. Please go ahead.
Hi, do we have a clearer idea on what the upcoming school year will look like and what policies will be in place to protect the spread of COVID-19 in the school system?
Yeah, so I know the department and the NLTA and the English School District and the Francophone School District has been working with public health officials. Once the announcement was made to open schools this year, there's a number of plans and scenarios that have been put in place, working with those groups. Safety, of course, of our students is our priority, and so therefore it was important to have discussions with all those groups, including teachers, including family members, busing services, and so on what the school year would look like, if indeed when it would start. There was a decision that was made by the department and by the school district to actually bring teachers in a few days early, I think about 3 days early, and of course these days, I think starting on sometime around September the 2nd, these days would be added to days off for the teachers, so no extra requirement for teachers to be in the classroom. They would be they would get extra days to compensate for those days of coming in early. So there's broad discussions right now what the opening of the school year would look like, and we're actually also talking to other provinces as well to see what their system would look like and make sure that we can bring our kids safely back to school within the K-12 system.
Thank you. Back to the military personnel that were seen in the downtown. Were there any testing? Was there any testing done since word of that incident, and is there any contact tracing underway?
We have no evidence that any of those individuals were symptomatic. I would have to refer you to U.S. military for what screening they use before they deploy troops to Europe, or if these were troops coming back from Europe to the States. I don't have that information. I would encourage anyone who has any symptoms to call 811 and seek advice, but we have not been made aware of anybody on that flight who was symptomatic.
Right, thank you. And many people are having difficulty equating why someone who works in a nursing home is only permitted to work in that one home, yet people can go out in public, out to bars, etc. Do they have a legitimate complaint, and why have those policies not changed, or are they reviewed regularly?
From my point of view, if you recall, the institution of the one worker, one home policy came at the height of clusters both in this province and across the country. We were actually the first jurisdiction to put in that requirement for long-term care and personal care, and I think every jurisdiction followed suit within a matter of a week or 10 days. What has happened as we have opened up is you describe the paradoxes we do see. One of our challenges now is to try and find what the best evidence is to guide how that policy should change. I was discussing that very issue with a meeting of various union leaders this week around whether or not that is still a necessary policy, whether or not it should be one worker, one long-term care or personal care home, whether or not it should be one worker, one career kind of thing, and whether it relates to jobs outside healthcare. Those are all under active consideration, and I think we will be, well, I know we will be looking at the decision and the policy over the course of the next little while. I think it would be premature to prejudge the outcome of that because I haven't received some later submissions from staff.
Thank you.
Our next questions are from Jody Cook of NTV News. Please go ahead.
Thank you. A question for the Chief Medical Officer in discussions on the considerations of mandatory mask wearing. We know that in other jurisdictions, i.e. the United States, this has become a highly politicized scenario. I'm wondering about your opinions on what you're seeing right now in this jurisdiction, in Newfoundland and Labrador, of people wearing masks when they're out at grocery stores and whatnot, if you're satisfied with the uptake on the amount of people who are wearing them, or if you would prefer that more people were doing so.
So our recommendations on masks, and as it's been for quite a while, is to wear them if you're out in public and you can't physically distance. So physical distancing is still the most important thing, and if you're and masking should not take the place of physical distancing. So it's very important to remember that. However, if you are in a situation where you may not be able to physically distance from someone, especially if you're going to be in that person's presence for more than 15 minutes, then you really should, we would recommend that you wear a mask in that situation. So if you're in a particularly crowded store, or if you were in a situation at work where you might have to be in a meeting where you're around people and are unable to physically distance, though that's not ideal, if you have a mask on for that period of time, it will be helpful. If you're using public transportation, where you're going to be in close quarters with people for an extended period of time and not able to physically distance, then those are the situations that we would like to see people wearing masks. That being said, we're in a period of low prevalence right now. If we were to move into higher prevalence of the disease, that advice may change, and we may be recommending it in different situations and be more, more stringent on where we would recommend the masks being worn. I think it certainly is not going to harm you to wear a mask in public if you're not sure. So if you're going to a grocery store and you're not sure if you're going to be able to physically distance for the whole time that you're there, put a mask on before you go in. Take it off after you leave. It's it's a very small step. It takes a matter of seconds. It could really prevent spread of the disease. So, you know, if in doubt, put it on.
Our most recent case announced on Sunday, we understand, is a contact of the previous cases in the Central Health region. Has all contact tracing been complete on that?
Yes, it has. That case had no further contacts.
And finally, I'd like to ask that, because a news release came out this afternoon in relation to some of the financial strains that public service members are under with a direct result of COVID-19, and then the conversation about looking at opening up pensions which are locked in to be able to access for some retirees. I'd like to ask that question. It is, I know, sort of skirting the COVID-19 briefing, but it is related to COVID-19. Can, Premier, you discuss a little bit about whether or not sort of what some of the requests were that you were receiving, and is that safe? We're hearing from financial advisors saying that this is a disastrous consideration.
Yeah. So it's something that's been considered, and you're absolutely right, Jody, and appropriate to ask this question because it is in some ways COVID-related, and you made your reference to some of the hardship that, you know, that people are ongoing right now during this pandemic. So what we're seeing here is a number of requests would have come in for people that, you know, that are receiving pensions. We have about 100,000 people in our province that currently receive pensions, and many of these are monitored by public sector workers or by government. So the whole idea here is to make sure that your pension plans can provide the financial security so that they could actually, you know, you can get the dividends that you put in place. You can expect that because most people plan their lives once they make a decision to retire around, you know, the financial resources that pension plan would provide it. So once you reopen these plans, I mean, there are certain risks that would be associated with that. Now, I know that, you know, over years there's been a number of attempts and people that have asked those very similar questions under different circumstances. So what we've agreed to do right now is to start an engagement process to take a look at what the impact would be. So fundamental in all of this is making sure that the plans would be there to be able to provide the financial support for the pensioners in the long run. So we would never make a decision like this that would actually disrupt the integrity of those plans. So what's important here now is to start an engagement process to take a look at this and see what the impact would be.
Our next questions are from Abigail Wellman of CFBS Radio, Blanc de Blanc. Please go ahead.
Good afternoon to everyone. Dr. Fitzgerald, a letter was sent to your office last Wednesday, July 22nd, from Randy Jones, the warden of the MRC de Gulf de St. Laurent, requesting that the people of the Lower North Shore be given less restrictive access to Newfoundland Island. Do you have an update on the status of this request and when a decision will be made?
So I don't have a record of receiving the letter, and we had looked into this when we were first asked that question. So I will take that back and we'll look into it again, but I don't have an update for you right now.
So if I could, I might be able to provide a bit of the background, and this all stemmed from a conversation that I would have had with a number of leaders, both on the Blanc de Blanc side and in the Straits area of Labrador. So what this has happened, as you know, we made provision similar to what we did in Lab West to actually the Blanc de Blanc, the Quebec side and the Straits side in Labrador to actually allow people to freely move back and forth this border. This is something, as I've mentioned about the Lab West border, that people in this area, there's close family connections and moving back and forth there for particular services that could be located either on the Quebec side or on the Labrador side. So it was meant to be so people can freely move back and forth that border, but not yet extend into the larger part of Labrador or the larger part of the island of the province. So there's been a request that would have come in now. So that what that would allow was that people from the Blanc de Blanc area would actually come to the Labrador portion of our province or go into other parts of Labrador. Now, so far, we've restricted that simply because, you know, it's very similar to what's happening in New Brunswick. They can come in from the Quebec side into the bordering communities in New Brunswick, but on a day basis. So what this would do is would open up, you know, people that can actually move, you know, to other areas of Quebec, and they do this infrequently. I know that, so it's not something that happens often. So we want to be very cautious. This is the reason why the plan was sent to public health officials. But right now, if we allowed that to open up, what it would mean that you could actually travel anywhere in this province. And if the example was taken from outside of the Atlantic bubble, well, that would mean Newfoundlanders and Labradorians in Alberta would still be forced to self-isolate when they came back home, but yet if you were a resident of the Quebec North Shore, that you could actually come into the province without self-isolating. So, we'll look at this. It'll be monitored. It'll be researched, and it will be analyzed, and a decision will be made. But we just want to make sure that everybody gets treated fairly.
So if I may follow up to that question, then you can confirm, Dr. Fitzgerald, that you have not yet seen this letter?
Well, they can, if I can, just one thing I want to say to conclude my comments on this is let's keep in mind, they can apply for a public exemption anywhere right now. So for residents that live in that area, if they need to come into the province for a various service, if it was health related or so on, they can actually apply like any other person that lives outside of the Atlantic bubble can apply through a exemption order to come in and receive those services within Newfoundland and Labrador.
And sorry, Dr. Fitzgerald, would you mind just confirming if you have seen the letter yet?
I haven't seen the letter at this point, but I can certainly look into whether or not the office has received it.
Also, my next question is, on the Government of Newfoundland and Labrador website, it now states the following: individuals that travel for work within the Atlantic provinces, Nova Scotia, New Brunswick, Prince Edward Island, and Newfoundland and Labrador, as well as within the communities along the Labrador-Quebec border, including Labrador City, Wabush, Fairmont, the Labrador Straits area, and Blanc-Sablon, no longer need to isolate upon return to the province. So my question is that if people traveling from within your bubble for work that come to Blanc-Sablon is without necessity to isolate, this seems to indicate that the area of Blanc-Sablon is not a COVID threat to the people traveling within your bubble. Would this be correct?
So we know that the incidence of COVID-19 in that area is low. But the Atlantic bubble is separate from what's happening with the Quebec-Labrador border.
So even though the prevalence might be low, and it is, and this is very difficult because what we know is that in this particular area, the province-to relationship has been excellent, and for many, many years has been excellent. But we also know that if you live in, for instance, that area, and you move into one of the communities inside Quebec where the incidence and prevalence of COVID could be much higher, when you come back to your own community, you do not have to self-isolate. So people can actually move freely around Quebec in this particular case and move back to their own community and not self-isolate. So there is a bit of a distinction here of what happens in other provinces, and this is the reason why there's been I guess a letter that has been sent in to public health officials with an example of what could happen in that area. But we need to make sure that we look at all the jurisdictions, not just certain regions of it is in this before the decision will be made. And public health officials will take a look at this. This was a commitment that we've made. It's literally less than a week ago right now. But I want to reassure the people that live in that area, we respect and we understand the close relationship and ties that they've had to Newfoundland and Labrador, but we are in a pandemic, and there's considerations that we must take before final decisions are made.
And thank you for your time.
Thank you.
Thank you very much for the reporters who tuned in today. I would now like to turn this back to the Premier. And Premier, I also want to say thank you very much for all of your hard work over the past few months with our COVID briefings, and wish you all the best.
Well, thank you, Kathy. And as I said earlier, day 144, and I know when I made a decision to let it be publicly known that I would not be seeking re-election, and therefore I would be stepping down as Premier. I didn't realize at the time in February that this would take me right at this table still in August of this year. But, I made a commitment to work with people in our province as we face this worldwide pandemic. So I made a commitment that I would see this through until a successor is chosen. So as we conclude today's briefing, I want to say, and it's been an honor to serve you as Premier of the province through this unprecedented time. I've worked alongside some remarkable people throughout this pandemic, without whom we would be in a much different position than we are right now. They are a small, but they're a mighty team of people behind the scenes who have been working day in and day out to protect the residents of our province. And I am, as Premier of this province, forever grateful for working alongside this incredible team. So to Heather and Sheila, who provide the interpreting services, I want to say thank you. You are indeed the voice of many, many people, and every single day since March, you've been providing this important service of people who are deaf and those of hard of hearing in this community. Your communication is important information throughout the pandemic, and I want to thank you very much. So if you could actually see inside this room today, there's literally just a handful of people. So to Derek, who is a one-man show behind the scenes, making sure that you get, that things are up and running. Facebook Live is available to you, and I want to thank you very much. And from time to time, as he is behind the cameras, he's also taken the odd picture that we can actually share with you. To Minister Hagee, we've been through a lot together throughout the years, and I want to thank you, sir, for your friendship and for your professionalism and for the humor that was appropriate as we've worked through this pandemic. So thank you very much. And to Dr. Fitzgerald, who is a woman who has been sitting at my left over these last 5 months. It's been an absolute honor for me to be able to work with you, your strength, your dedication. I would say your wise decision-making has been inspiring to all of us. I could think of no other person that I would want sitting with me today at these panel than these two people, Minister Hagee and Dr. Fitzgerald. So as I conclude my remarks today, I want to once again thank Heather and Sheila, to Derek and to Jeremy, as part of my staff that work in my office that provide me support on a daily basis. And to all the essential workers, and I remember those very difficult days very early in this pandemic, that you stood up and you provide services that were essential to Newfoundlanders and Labradorians. I want to thank you very much. To all the Newfoundlanders and Labradorians who seriously followed our public health guidelines and got us to where we are today, in one of the safest positions that you'll see anywhere in any jurisdiction when you compare where we are as a province. And to the media, not often do I get the opportunity to publicly thank the media for your questions. You've asked your questions on behalf of the residents of our province. And once again, I acknowledge the work that you do in showing up every day. So to this panel, it's been my privilege. But before I conclude my remarks today, I want to make a presentation. I want to make this presentation to Dr. Fitzgerald on behalf of myself and my family, and to all, and from all Newfoundlanders and Labradorians. So let me get this. It's tucked away underneath this desk. So the first thing is from one of my favorite companies. It's from the Newfoundland Chocolate Company. We've got an assortment of bars of some of the sayings that we know, so I want to share this with Dr. Fitzgerald and say thank you.
Thank you very much.
And there's one other gift that I would like to give to her today, which I also think is appropriate. And this is a street sign that she could put somewhere in her favorite little tucked away spot, and it says Fitzgerald Way. So there you go. You've been providing the waypoints for us throughout all of this.
Thank you
And
so much.
before I conclude my remarks today, I want to thank every single Newfoundlander and Labradorian for the great work that you have done. And to quote a famous Newfoundlander today, I say, hold fast, Newfoundland and Labrador. Stay safe, everyone.